take over.
Thanks, Joe. And you hear me?
I can hear you.
Excellent. So we'll see if I can advance these slides. I
Takes a second.
appreciate being here with you and with James and all those attending. I had a baby son this past week, and so it's been a whirlwind week for me, but I still wanted to come on here and wanted to talk about bioactive garments. And I actually, Joe, texted or emailed your team asking for some of my wife's abdominal pain
Okay.
sort of binder, because we got a different binder in the hospital. So, I think this is all a work in progress. Like most things in orthopedics, we learn about new technologies at meetings, conferences. We have trusted colleagues, friends, and mentors. James Pacey is one of them, and others who really turned me on to this several years ago, because it was, in my initial perception, just a sleeve, another type of sleeve, and it was inexpensive and available. I used it on patients, and I started seeing remarkable things, and not just the comfort compliance that James will talk about, and some of the ways he uses it, but I think there had to be more to it, and that led me into a deep dive as a clinician scientist. Joe and team provided hundreds of pages of documents that I sifted through, and we've had several kind of meetings as a key opinion leader and advisor to him and his company as it grows. And so I want to share some of that basic science with you at a very dumbed down orthopedic level. We can obviously get further into it if we want in the discussion portion of the meeting today, but let me see if I can advance these slides. If not, Joe, I'll ask you to do it. Here, Joe did touch on this a bit. I think it's important for us all who are using these sleeves and explaining to patients to at least understand a bit of the mechanism and how it's not just neoprene and it's not just compression. Essentially what's going on is that these semiconductors are embedded within the fibers of the fabric. And so they are both thermoconductive, so they basically get heat absorbed from the body, but reflective and highly reflective. And that really is what is happening behind the scenes, mimicking low-level laser therapy. And so this therapeutic modality, which is termed photobiomodulation, is really at the heart of all the processes. And so the amount of tissue penetration and then the effects at the cellular level are really what we think are happening with the Reparel sleeve. As I'll show you, there are a couple of different fabrics. They reflect at different infrared wavelengths and potentially have different mechanisms. Now, I will also submit, after reviewing a ton of this information, that there is high-level science, animal studies, and also clinical studies in multiple different fields in medicine and to some extent touching in musculoskeletal, but really the tip of the iceberg in sports medicine. And I think there's so much room to grow, and we really need to work together as a team here to put our money where the mouth is and really do high-level evidence-based science to prove that it's not just the basic science, that it's absorbing and reflecting, but it's also affecting change clinically for the patient, not just comfortable. And so hopefully that gives us a sense of where we are. We put this slide here just so that we can have nightmares about our previous physics classes, but really to remind us about the electromagnetic wave spectrum and to see where Reparel bioactive garments kind of fit in. And they really function where you see the arrow is in that near infrared window. This is also known, as you see, as the optical window or the therapeutic window. And it's really where there's maximum depth of penetration into the tissues. And so the two different sleeves, one for acute, one for more chronic inflammation, function a bit differently, either in the near infrared or the mid infrared range. That is what is really responsible for the photobiomodulation. And so here is just taking a little deeper dive into that optical window and what's actually happening at the cellular level. You can see that there's stimulation of mitochondria, increased ATP production. This leads to vasodilation, increased blood flow. There's a whole lot of different cellular processes that are going on. It can stimulate growth of the cells or repair. There's also evidence for gene expression, DNA synthesis repair, cell metabolism, and secretion of various proteins. So I think that, again, for each specific indication diagnosis, we will have to understand better how the fabric actually affects change on the different tissues. But if you're looking at high-level evidence for photobiomodulation, low-level laser therapy, and the applications, it's all there for us to review. This is some work, maybe we can ask Joe about this in a bit, that they did at the Colorado School of Mines, and basically looked at the two different fabrics and looked at that versus a control, and showed that in fact these do operate and function at the different wavelengths within that therapeutic window. I think just pivoting here, let me see if I can advance. Yep. So what are the clinical applications of photobiomodulation? And again, look at that cartoon on the right, because I think that that's the easiest way for us to conceptualize for our patients. You can see the body heat reflecting off the nanoparticles and then back into the body to affect change, hopefully promoting healing, remodeling, reducing inflammation. And there are different targets, obviously. This could target muscle, this could target lymph nodes, this could target the nerves. And really these different targets, their different cellular mechanisms are why this has such broad applications, not just in MSK, but for other applications. And there have been over 4,000 studies that are listed on PubMed regarding photobiomodulation. Obviously only a few in the sports medicine and the arthritis realm. But, there is more that we could draw on in the thyroiditis, traumatic brain traumatic brain injury. And also there's data from neuropathies, dysmenorrhea, which is why I was interested for my wife, and vasculitis, gloves for Raynaud's syndrome. And, musculoskeletal conditions in the past, there's some data on Achilles tendinopathy. There's some science behind muscle exercise and recovery. It is obviously intriguing that this could, if it does work, be part of an active recovery process while you're sleeping or resting, which I think is quite intriguing, and also in autoimmune diseases. So the key points for me, it's safe and inexpensive. I think James will talk about how he's implemented this into his practice, and then we can have a conversation around that. I think we have both, and others of our KOLs, challenged the company to really get behind the evidence in sports medicine and in osteoarthritis. There are several case studies now that we have, and randomized controlled studies that are being done around the country at different academic and non-academic centers. And I think that hopefully the data from those will provide more of a launching pad for larger scale adoption within the sports medicine population at large. And so with that brief introduction into the basic science, I'll turn it over